So welcome back to Fraud Fact Friday, Tammy and Mike.
Thank you.
It's good to be here in Aachen again.
Yeah, we're in person again for an interview, which is much more practical. And we're going to be talking about, again, medical billing fraud. We've already covered unbundling. We've covered unnecessary drug tests. And something I want to address this time has to do with your background in the nursing space. Trauma team activation. Can you tell me a little bit about that?
Yes, trauma team activation is when a person or a patient has been in a very bad motor vehicle accident and they're taken to the hospital and they're either going to bleed out in the next 30 minutes, heart's going to stop in the next 30 minutes, or they're going to quit breathing in the next 30 minutes.
Okay.
One of those things, they're very critical, and you have a team of people that come together to save that patient's life.
Mm-hmm.
And what is happening is those charges, because you've got such a large team of people trying to save that patient's life, is anywhere between $8,000 to $30,000. It varies across the United States.
Okay, which is a price worth paying, I guess, for saving lives.
Correct.
So what is the problem then?
Well, the problem is we find that in minor accidents that these charges sometimes appear. So someone with a minor accident where there's just a small dent on the bumper and minor injuries or no injuries, and yet a trauma team activation will show up on the emergency room bill.
Okay, and it's paid out.
Mm-hmm.
Okay, so why does this work?
It works because claim reps are taught, and they're taught properly, they owe for the day of the injury. Myself as a nurse, I totally concur with that a patient or an insurance company owes for charges that occur on the date of the accident.
Mm-hmm.
But what happens is they are not scrutinizing those bills. And if someone's been in a minor vehicle accident and they're in the ER for 2 hours, they're triaged, and then they see the doctor for 5 minutes, and they go home with all in a period of 6 hours, that was not a trauma team activation.
Okay.
That is totally incorrect. But a lot of claim reps have not been taught that.
Okay. So how many times do you see this pattern?
We see this 100 times every year. Tammy and I review at least 200 or 300 files per year that include a invalid trauma team activation. And we'll review 2 or 3 or 4 files each year where it is a valid trauma team activation where there was a serious injury.
And maybe a last question, how do you identify this pattern?
Well, this is really easy. If you're working in the claims area in an insurance company and you get a very large emergency room bill that includes a trauma team activation, and yet you see from the pictures and the damage estimates on the automobile that it's a very minor accident, you know you have a big problem.
Okay. Well, thank you once again for coming back on Fraud Fact Friday, and I am sure we'll be in touch again for another episode.
Thank you for
David.
having us here.
Thank you.